The mahogany dining room table in my father-in-law's sprawling estate gleamed under the warm light of the antique chandelier as our extended family gathered for Thanksgiving dinner. I sat quietly beside my husband Michael, still wearing my simple cardigan and slacks from the morning shift at the community clinic, feeling underdressed among the designer dresses and tailored suits around me. "So Elizabeth," my father-in-law Richard boomed from the head of the table, carving the turkey with theatrical precision, "still playing doctor at that little clinic downtown?" His voice carried across the room, drawing attention from Michael's successful siblings and their equally accomplished spouses. I looked up from my untouched plate. "I work at the Riverside Community Health Center, yes." "Community Health Center," Richard repeated with a condescending chuckle. "That's a fancy name for a free clinic, isn't it? Where people go when they can't afford real medical care." Michael's sister Jennifer, a high-powered attorney, joined the conversation. "Elizabeth's always been dedicated to helping the less fortunate. It's admirable, even if it's not exactly a lucrative career path." I continued eating quietly, accustomed to being the family charity case at these gatherings. "The problem with Elizabeth's choice," Richard announced to the assembled guests, "is that she's wasting her medical training on people who can't pay. Real doctors build practices with real patients who have real insurance." Michael's brother David, a successful investment banker, nodded in agreement. "Elizabeth could be making serious money in private practice instead of subsidizing healthcare for people who should be taking responsibility for their own medical bills." My mother-in-law Patricia chimed in from across the table. "Don't get me wrong, dear, charity work is lovely. But at some point, you need to think about building wealth for your future with Michael." "Exactly my point," Richard agreed, gesturing with his carving knife. "Pretend doctors work at free clinics. Real doctors understand that medicine is a business, not a charity." Michael's cousin Sarah looked sympathetic. "Elizabeth, have you considered transitioning to a more traditional practice? Something that actually generates income?" Before I could respond, Richard was off and running again. "The fundamental issue is that Elizabeth doesn't understand healthcare economics. She's treating medicine like social work instead of recognizing it as a profit-generating profession." Jennifer nodded knowingly. "In my legal practice, I only take clients who can pay my rates. It's not cruel, it's realistic. You can't run a sustainable business giving away your services. That's the difference between real professionals and people playing at being professionals," Richard declared triumphantly. "Real doctors charge real fees to real patients. Free clinic work is just pretending to practice medicine." My phone buzzed against my purse. I glanced at the screen. "Riverside Healthcare Network Executive Office." "See." Richard pointed at my phone. "Even on Thanksgiving, the clinic is calling her about some administrative crisis. No boundaries when you're basically volunteering instead of running a real practice." I silenced the phone and returned to my meal. "The thing about free clinics," David added, "is that they're financially unsustainable. Elizabeth will never build equity or retirement savings working for charity wages." Patricia looked genuinely concerned. "Honey, you're 34 years old. Don't you want to own something? Build a practice that has actual value." "Michael," Richard addressed his son directly, "you need to talk to your wife about this. She's wasting her potential on people who should be going to emergency rooms instead of taking up a real doctor's time." My phone rang insistently. Same caller. I realized this might be urgent. "Excuse me," I said, standing from the table. Richard rolled his eyes dramatically. "Ladies and gentlemen, this is exactly what I'm talking about. Free clinic doctors are always at someone else's beck and call because they're not running their own businesses." I stepped into Richard's study and answered. "Dr. Reynolds speaking." "Dr. Reynolds, this is Margaret from the executive office. I'm terribly sorry to interrupt your Thanksgiving dinner, but we have an urgent situation requiring your immediate approval." I could hear Richard's voice carrying from the dining room, explaining why charity medicine was a dead-end career. "What's the situation, Margaret?" "The board meeting for the Central Valley Hospital acquisition has been moved to tomorrow morning due to regulatory deadlines. The purchase agreement is worth $180 million, and the sellers need final approval by midnight tonight." I glanced back toward the dining room where Richard was pontificating about the difference between real doctors and pretend doctors. "Have legal and finance completed their due diligence?" "Yes, and the numbers are excellent. Central Valley would add 240 beds to our network and give us complete healthcare coverage in the Tri-County area. Combined with our existing facilities, we'd serve over 600,000 patients annually. What about staffing integration? HR projects will create 400 new jobs and retain all existing Central Valley employees. Dr. Martinez wants to personally address the medical staff about our patient care philosophy. I looked back at Richard, who was explaining to the table why people who couldn't afford private health care shouldn't expect quality medical care for free. Margaret approved the acquisition. Schedule the board meeting for 8 a.m. tomorrow, and I want a comprehensive integration plan within 30 days. Of course, Dr. Reynolds. Should I alert the media relations team? This acquisition will make Riverside the largest healthcare network in the state. No media announcements until after the integration is complete. And Margaret? Make sure all Central Valley employees understand that no one will lose their job because of this merger. Understood. Anything else? How are patient satisfaction scores at our newest facility? Outstanding. 98% satisfaction rating, and we're seeing increased patient volume from surrounding areas. Excellent. Email me the quarterly report first thing Monday morning. I hung up and returned to the dining room, where Richard was in full swing explaining why free clinic work wasn't real medicine. The bottom line is that Elizabeth has never learned to think like a business owner, he was telling his captivated audience. She's content being an employee at a charity clinic instead of building something valuable. As I sat back down, David looked at me curiously. Everything okay, Elizabeth? Work emergency? Something like that. Richard chuckled. Let me guess. Someone called in sick and they need Elizabeth to cover extra shifts at the free clinic? That's the problem with charity work. No professional boundaries. Actually, I said quietly, it was about a hospital acquisition. The table fell silent for a moment. Hospital acquisition? Jennifer repeated slowly. We're purchasing Central Valley Hospital for $180 million. The board meeting was moved to tomorrow morning. Richard laughed loudly. Elizabeth, you don't need to make up important-sounding work to impress people. We all understand that free clinic employees don't handle hospital acquisitions. I'm not a free clinic employee, Richard. Of course you are, dear. You work at that community health center downtown. The community health center is part of Riverside Healthcare Network. I'm the founder and CEO. The dining room went completely silent except for the ticking of Richard's antique grandfather clock. That's impossible, Richard said flatly. Riverside Healthcare Network operates 11 hospitals, 43 clinics, 6 surgical centers, and 2 urgent care networks across 3 states. We employ over 18,000 people and generate approximately $2.1 billion in annual revenue. David's fork clattered against his plate. Margaret appeared in the dining room doorway, looking professional but apologetic. Dr. Reynolds, I'm so sorry to interrupt, but the Central Valley legal team wants to finalize the purchase documents tonight instead of waiting until tomorrow morning. Every head at the table turned to stare at Margaret, then back at me. Tell them I'll review and sign the documents within the hour, I said to Margaret. And schedule a conference call with their medical staff for Monday morning. Of course, Dr. Reynolds. Should I have the contracts sent to your home office? Yes, and Margaret? Please coordinate with Dr. Martinez about the staff integration plan. I want every Central Valley employee to feel welcomed into our network. Absolutely. Thank you, Dr. Reynolds. As Margaret left, the table remained frozen in shock. Who was that? Patricia whispered. Margaret Collins, my executive assistant. She coordinates board meetings and acquisition approvals. Richard stared at me as if I'd grown a second head. Elizabeth, what's happening here? I'm about to sign documents to purchase a 240-bed hospital system, which will make Riverside Healthcare Network the largest private healthcare provider in the state. Jennifer pulled out her phone with shaking hands. I'm looking at Riverside Healthcare Network's website right now. Dr. Elizabeth Reynolds, founder and chief executive officer. She looked up at me. That's you. Yes. It says you pioneered a new model of integrated healthcare delivery that combines private practice efficiency with community health accessibility. We believe everyone deserves quality healthcare regardless of their ability to pay. Our profitable services subsidize care for uninsured patients. David grabbed Jennifer's phone and scrolled frantically. This says you were named Healthcare Entrepreneur of the Year by Forbes magazine. 2 years ago, yes. Richard found his voice. But you work at a free clinic. I work at the community health center 1 day a week as part of our commitment to underserved populations. The rest of my time is spent running the healthcare network. How much, Patricia asked quietly, is your company worth? Our last valuation was $3.8 billion. We're considering an IPO next year to fund further expansion. The silence stretched for nearly a full minute. $3.8 billion, Richard repeated in a whisper. Money isn't the primary motivation, Richard. We've created jobs for thousands of healthcare workers and provided medical care to communities that were previously underserved. Sarah looked stunned. Elizabeth, we had no idea. Why didn't you tell us? Tell you what? That providing free healthcare was actually profitable? That pretend doctors could build billion-dollar businesses? That community health centers could be part of major healthcare networks? Richard looked genuinely stricken. Elizabeth, I've been calling you a pretend doctor for years. You have. While you were building the largest healthcare network in the state. While I was solving problems, Richard. Healthcare access, quality care delivery, sustainable business models. The financial success was a byproduct of creating value for patients. David shook his head in amazement. Elizabeth, you've accomplished something none of us could have imagined. I started with one community clinic and grew from there. Every acquisition, every expansion was about serving more patients who needed care. Jennifer looked mortified. We've been condescending to you about your career choices while you were building a healthcare empire. You weren't wrong about the importance of building sustainable businesses. You just assumed I hadn't figured that out. Michael, who had been silent throughout this exchange, finally spoke. Elizabeth, I'm so proud of what you've built. And so ashamed of my family's assumptions. Michael, there's nothing to be ashamed of. Your family values success and entrepreneurship. I just define success differently. Richard stood up slowly. Elizabeth, I owe you the most profound apology of my life. Richard, you don't need to. Yes, I do. I've spent years dismissing your work as charity, calling you a pretend doctor, acting like you didn't understand business principles. Meanwhile, you were building something I could never have conceived of. The work itself has value regardless of the financial returns. The patients who come to our community health center need care just as much as those who can afford private practice fees. But you've proven that providing that care can also be incredibly successful business-wise. I smiled. Healthcare doesn't have to be either profitable or compassionate. It can be both. Margaret returned with a briefcase full of legal documents. Dr. Reynolds, the Central Valley acquisition papers are ready for your signature. As I signed the documents that would add another hospital to our network and create hundreds of new jobs, I could feel my in-laws watching in awe. Elizabeth, Richard said as I handed back the signed contracts, can you forgive us? Can you tell us about what you've really built? I'd be happy to tell you about our work. But first, let me finish this acquisition. Central Valley Hospital serves a lot of families who need our help. Patricia looked amazed. You're buying a hospital on Thanksgiving Day. Healthcare doesn't take holidays, Patricia. And neither do the opportunities to serve more patients. As Margaret left with the signed documents, I returned to my seat at the table. The conversation had shifted completely. Instead of dismissing my work, everyone wanted to understand it. Elizabeth, David asked, what's next for your company? We're exploring expansion into underserved rural areas. There are communities with no access to quality healthcare within a 50-mile radius. And that's profitable? It will be once we establish the infrastructure and patient base. But even if it weren't, it would still be the right thing to do. Richard raised his wine glass. To Elizabeth Reynolds, who proved that real doctors can work at free clinics and build billion-dollar businesses at the same time. As the family toasted, I thought about Monday's integration meetings, the patients who would benefit from our expanded network, and the communities we'd serve. Just another day at the office.